Welcome to Lexcura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of Lexcura Summit. Medication management in home health is one of the highest risk aspects of care, and one of the most legally complex. Nurses are required to reconcile medications during skilled visits, while home health aides must remain within clearly defined boundaries. When the record shows that a patient received the wrong dose, a potentially dangerous interaction was overlooked, or an aide performed a task outside their permitted scope, the medication record may become central to both breach and causation. In this episode, I will explain how to read home health medication records, identify what went wrong, and connect the documentation to the patient's resulting harm. Okay, so here's something to think about. Medication errors are one of the leading causes of preventable harm in healthcare. And in home healthcare, the stakes are even higher because the system is so fragmented.
That's a pretty sobering thought. I mean, when you think about it, home healthcare is supposed to be this safe, supportive environment, but it's also where so many things can go wrong.
Exactly. And today, we're diving into one of the most critical aspects of home health care, medication management, and asking the big question, who's really responsible when something goes wrong?
Right, because it's not always clear. You've got doctors, nurses, caregivers, pharmacists, even family members all playing a role. And when there's a breakdown, it's like trying to untangle a giant knot to figure out where it all started.
And that's where causation chains come in. They're essentially the investigative tool that helps us trace back through all those steps to figure out what went wrong and why.
So it's like a roadmap, but instead of leading you somewhere, it's leading you back to the source of the problem.
Exactly. And what makes it so fascinating and frustrating is that it's rarely just one thing or one person. It's usually a combination of factors that all come together in just the wrong way.
And that's what makes these cases so complex, right? Because you're not just looking for a single mistake. You're looking at an entire system of care and trying to figure out where it broke down.
Right. And when you think about it, the stakes couldn't be higher. We're talking about people's lives here, patients who are often already vulnerable, families who are trying to do their best, and caregivers who are juggling a million responsibilities.
And when something goes wrong, it's not just about the immediate harm. It's about the ripple effects, hospitalizations, long-term health impacts, even legal and financial consequences.
Exactly. So, let's break this down a bit. What exactly is a causation chain, and how does it work in the context of home health care?
A causation chain is essentially a sequence of events that leads to a specific outcome. In home health care, it's used to trace back through all the steps leading up to a medication error or other adverse event.
And the goal is to identify the point or points where something went wrong.
Right? And that could be anything from a doctor prescribing the wrong medication, to a pharmacist mislabeling a bottle, to a caregiver misunderstanding the instructions.
Or even a combination of those things.
Exactly. And that's what makes these cases so challenging. You're not just looking for a single mistake. You're looking for a pattern, a series of missteps that collectively led to the outcome.
And that's where the legal side comes in. Because once you've identified the causation chain, you have to determine who's responsible for each link in that chain.
And that's not always straightforward. For example, let's say a caregiver gave a patient the wrong dosage of a medication. On the surface, it might seem like the caregiver is at fault.
But if you dig deeper, you might find that the caregiver was given unclear instructions, or that the prescription itself was incorrect.
Exactly. And that's why these cases often involve multiple parties and multiple layers of investigation.
And multiple layers of emotion too. I mean, these are real people we're talking about. Patients, families, caregivers.
Absolutely. And that's what makes this such an important topic. It's not just about the legal or financial implications. It's about the human impact.
So let's talk about some real-world examples.
Sure, one case that comes to mind involved a patient who was prescribed a medication that had a known interaction with another drug they were already taking.
And no one caught it?
No one caught it. The doctor didn't check the patient's full medication list. The pharmacist didn't flag the interaction, and the caregiver didn't question it.
And what happened?
The patient ended up in the hospital with severe complications.
That's heartbreaking.
It is. And it's a perfect example of how a breakdown in communication can have devastating consequences.
And it's not just about communication either, it's also about systems and processes.
Right? In many cases, these errors could have been prevented with better systems in place, like electronic health records that flag potential drug interactions, or standardized protocols for medication management.
And that's where the idea of accountability comes in. Because at the end of the day, someone has to be responsible for making sure those systems are in place.
And for making sure they're being followed.
Exactly. And that's why these cases are so important. They're not just about assigning blame. They're about identifying weaknesses in the system and finding ways to fix them.
And hopefully preventing similar mistakes in the future.
So what's the takeaway here?
I think the takeaway is that medication management in home healthcare is incredibly complex. It's not just about one person or one action. It's about a whole system of care.
And when that system breaks down, the consequences can be devastating.
Absolutely. And that's why it's so important to have clear communication, robust systems, and a strong sense of accountability.
Well said.
Thanks.
And on that note, I think we'll wrap things up.
Sounds good.
Thanks for listening, and we'll see you next time.
Take care.
Thank you for listening to LexCura Clinical Insights. Medication cases are rarely established by a single entry. The strength of the analysis comes from connecting the medication list, reconciliation records, physician orders, visit notes, administration documentation, changes in the patient's condition, and the actions or inaction of the care team. When those records are read together, they can reveal whether a medication failure was simply documented or whether it contributed directly to the patient's injury. For more clinical intelligence, litigation analysis, and practical guidance, visit LexCura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of LexCura Clinical Insights.